Our attention on a most critical matter. Media coverage, congressional hearings, a White House task force to protect students from sexual assault, that campaign, It's on Us, and various public, private, and higher education leaders have magnified the need to understand and address campus safety. But for the University of Kentucky, this issue has long been part of our focus and commitment. 10 years ago, long before I got here, at this university, under the direction of President Lee Todd, we began conducting path-breaking research. We were asking the tough questions then, long before those questions were in the national spotlight. We developed a survey to assess our students, and over the past decade, we have invested the time and the personnel to respond to what we learned. So programs like Green Dot were birthed at this university, and they've become a national model for bystander intervention. The statistics we hear are very compelling. We've continued to invest in the personnel and the technology to make this campus safe. And the people who come here from wherever, who are part of this family, safe wherever they may be. But there is still more work to do. There are still questions we must continue to answer. Which is why last semester I charged UK's Center for Research on Violence Against Women to help us better understand our environment. We have incredible expertise. I would venture to say it's unparalleled anywhere in this country on this campus to help us answer these questions. The team at the center, faculty, statisticians, and staff in UK Analytics, led by Dr. Fallingstad, developed an ambitious plan to gain a better understanding of our campus so that we can make data-driven decisions that impact safety and well-being. Today, we are sharing the preliminary results of what I feel certain is the first campus-wide survey of its kind. We surveyed everybody, not just a sample. And you'll learn from Dr. Fallingstad, there were incentives to participate, but even while you were participating, if you wanted to opt out of answering the questions, you could. But our students wanted us, in overwhelming numbers, to know what was on their minds. So I'm thankful to them. We knew that reports from the VIP Center and UK Police Department were important, but it's only through a deep, broad sample like this that you start seeing the whole story. We needed more information on which we could take action, so we took a bold step. As I said, it's a census survey. It's like a census we do in the United States. We went to talk or to listen to everybody. So this survey represents the next step in a long period of leadership on an important issue. The robust data that we gathered quite rigorously, both qualitative and quantitative, will help us continue to improve. So I want to thank all the people who make this happen, and I think each one of them will say there's a team behind them, but a few. Dr. Fallingstad, Dr. Heather Bush, Dr. Claire Renzetti, Dr. Ann Coker, Dr. Charlie Carlson, endowed faculty in the Center on Violence, on Research, for research on violence against women. And I thank them all for being here today. And one of the things that attracted me to the University of Kentucky, because it turned heads all over the country, was the Bucks for Brains program. Okay? Everybody in the United States noticed when Kentucky did that we made this investment. So today, all these people who are here, I think nearly every one of them are supported by funding that grew out of that innovative program. And that's another example of the impact a significant partnership with the state and private donors can have. It's being manifest here today in a very powerful way. And I also want to thank Jaspreet Chahal and Candice Brancato, who were instrumental in coordinating this effort. Adam Rechtenwald and UK Analytics and Technologies. And of course, our students who took the time to give honest feedback last spring. The survey underscores our steadfast commitment to never wavering on our attention to this critical issue. Although the preliminary results point to the fact that students perceive our campus as being safe, and they believe there is a faculty and staff at UK who care deeply about their well-being, they also signal to us that we have work to do. Too many students, still believe that sexual assault is a shame and a scorn that they cannot share. And not enough of them share it with these incredible professionals we have here who can help you navigate such a situation. So we want to do better. We've got to make clear this abundance of resources we have in both mind and heart that are ready to receive them. We have much on which to take pride, and we have much still to work and build on. But we start with what we are learning from what I believe is a groundbreaking survey that should be a model for those who will follow and those who we can share the lessons we are learning. So now to share the preliminary findings, please welcome Dr. Diane Fallingstad, Women's Circle Endowed Chair and Director of the Center for Research on Violence Against Women. Dr. Fallingstad.
Thank you, President Capilouto, for your dedication to this issue, which has resulted in a 5-year initiative. It is the combined efforts of the faculty and the staff at the Center for Research on Violence Against Women that has allowed us today to present some preliminary information. The only name I want to add to that wonderful list is Tracy Doyle, who is our administrative staff officer, who, as she says, keeps the rest of us working. Because these are preliminary data, what we're presenting today is student body information. These are data that are the perceptions of students at UK as well as their adverse experiences. And we had asked them to report on this over a 12-month period. The final report, which we hope to include a lot more nuanced analyses, all of the variables in the study, as well as important demographic breakdowns, should be available later this year. Also important, where applicable, the data that we collected for the CATS, Campus Attitudes Towards Safety Survey, will reflect legal definitions and federal guidelines for collecting information of this type. However, it's very important for you to know that this project, initiated by President Capilouto, was meant to be more than just collecting data for legislated required reporting purposes. This is meant to collect the kind of information that would be applicable to many different service units and different aspects of UK, for which the data can then be used for policy changes, programming, and to change the culture of the university. So with this in mind, what I would like to do is give you the massive piece of data, which is the participation numbers. We had 24,382 students complete the survey. I'm always amazed at this number, but probably more amazing is the fact that we were able to get 81% of the students to complete the survey before registration began, so that when registration opened, there were very few students who still had holds on their registration. It made the process go very, very smoothly. Now, a lot of people have said to us, well, how can you just mandate that students take such a survey? We were very sensitive to the issues of privacy and choice for the students. So although all of the students were given the opportunity to provide feedback on this survey, every single answer had the response option, choose not to answer. So a student could go all the way through and choose that as an option and not provide personal information. What I'm amazed at is that only 1.8% of the students chose to do that, to choose not to answer for every single option. These are 3 demographics that we'll be using later to do a more of the nuanced breakdown of the data, but you'll see that we have more females than males who took the survey. About 2/3 are in-state students, and the student classification, we will be breaking out the first-year students from other years of undergraduates and also separate from professionals and graduate students. First-year students are considered more vulnerable, so we will definitely be looking at their data separately. Because this was a campus climate survey, not just a campus violence survey, we were very interested in students' general perceptions of safety, their perceptions of how UK responds to a report of sexual assault. We wanted to assess their knowledge when reporting a sexual assault, and we also were very interested in what kinds of risky behaviors they encounter. So these first 4 slides will deal with these campus climate issues. This first one deals with general perceptions of safety, and we find that almost all students, 98%, say on campus during the day they feel safe. Again, the vast majority, 77%, say they feel safe on campus at night. What is interesting is that when you ask them, generally, do you think UK cares about your safety, 94% say that they agree with that. And we do find students signing up for these crime bulletins at a pretty good rate, 86%. An exception that we have is that half of the student, well, actually more than half of the students think that sexual violence is a problem at UK. And remember, they're not reporting on actual incidents, but this is their perception that this is still a problem that needs to be worked on. So how do students perceive that UK will respond to a report of sexual assault? Generally, they think UK as an institution would be fair and helpful. And we separated out asking about UK administration from the campus police, and we find out that for both administrators, 91%, and the UK police, 93%, that students believe that this would be handled in a helpful and fair manner. We had spoken with the Office of Student Affairs early on, as we did with many stakeholders, and based on their anecdotal information to us, we also included an item that would have to do with the student response on campus to a student reporting a sexual assault. And we find that it is unfortunate but very interesting that half of the students expect that if there is a student reports a sexual assault, that either the accused person or their friends will come up with some kind of retaliation campaign against them. However, most students, 91%, believe that UK administration will do whatever they can to prevent that kind of retaliation from happening. Knowledge about reporting a sexual assault is important for finding out whether or not they know about resources, but also if they understand ramifications of reporting. While these numbers look pretty good, it's still important to think that we have 1/4 to 1/3 of the students who seem to have inaccurate information about reporting a sexual assault. These answers are, we found out whether or not they knew the correct answer. This isn't agreeing, this is did they actually know the right answer. We find that about 1/4 of the students did not know that if they told most of the UK personnel that that individual would be mandated to report to some UK official. And about 1/3 did not seem to know that if they told someone, a coach, a teaching assistant, that that would trigger off a formal investigation. 1/4 of the students were not aware which of the sources on campus were confidential, like the Violence Intervention and Prevention Program, counseling, UK Health Services. And the biggest gap is about 40% of the students don't realize that if they were to report a sexual assault, that there might be accommodations that could be provided for them. For example, if they wanted to move to a different dorm than the person who committed the assault, or if they needed extended time with some of their schoolwork, those kinds of accommodations. Now, confidentiality issues are tricky. If a student wishes to tell someone but doesn't wish to trigger off an investigation. So if a student doesn't know this information, they may go to confide in someone, such as a resident advisor or a faculty member, only to find that they've triggered off an investigation. We want to encourage students to report sexual assaults, but we also want them to be informed about their decision-making. And we do know that confidential sources here on campus are excellent for providing people with the full range of what are your options and what might you do. Another way to understand campus climate is to find out what type of risky behaviors our students encounter. And we asked about several situations that we actually thought students could potentially intervene were they to encounter this. 17% of our students say that they have witnessed someone, while they were drunk or high, they believed being led away for sex, with the implication the person wouldn't be able to consent. We have 12% saying that they know of a relationship that involves a student on campus where one member of the relationship is being physically hurt by the other. 10% have heard someone bragging or justifying why they made someone have sex with them, and 8% either observed or suspected that drug or alcohol were slipped into someone's drink without their knowledge. Now, these are not necessarily incidence markers because, as you know, this could have happened at a party where a lot of people could have witnessed the same event. But at least these are people who are saying, I have seen these things occur. We believe that even asking some of these questions on the survey can be something of a mini intervention, because if they have to have awareness of what is going on around them, they may stop and think about the fact that they could step in, they could prevent violence, they could prevent someone from being a victim of violence. And these are actually part of a series of questions about bystanding, which, as you know, is a program here on the UK campus. Now the data on what actually is happening to students at UK. We assessed items on bullying, sexual harassment, and stalking to go beyond what many surveys do of just asking about sexual assault or intimate partner violence. If you look at the first 4 bars, the purple bars, these give different types of bullying. Now, if you can't add these together because some students reported more than one type, but we know that 23%, or almost a fourth of our students, report some form of bullying from another UK student during the past year. The most common type, as you can see, is verbal bullying. That is to a person's face or kind of in earshot. 16%. We have social media bullying, which I know the Office of Student Affairs has been very concerned about, 13%. But even physical bullying and bullying because someone appears to be LGBT, we have incidents of 6% of the students reporting both of those categories. The next 2 lines, the gray lines, deal with sexual harassment. When we ask our students 5 different items that range from somebody said something sexual to you that you didn't want, all the way to somebody exposed themselves to you, 23%, again, almost a fourth of our students, report a sexual harassment incident in the past year. What we wanted to do was to find out how much of this is our campus climate. So we also asked anybody who had been sexually harassed whether or not it was a UK student, a UK employee, or somebody not connected to UK. And please remember that a UK employee is everything from a coach, a teaching assistant, a graduate assistant who is helping out in a research lab. It's a full range, coaches, it's everybody, including staff. To then find out, to look not just at what is happening to UK students, because we care about providing services, we found that 16%, or approximately 2/3 of the individuals who were experiencing the sexual harassment, said the person who did it was either a UK student or a UK employee. So we definitely have individuals who, as they go out into the world, are being sexually harassed and may need services as well. The final two, the two blue bars at the bottom, have to do with stalking. We used federal guidelines to ensure that these were incidents where the person felt fear because of what the stalker did, in terms of they left something or they broke into their car, whatever it was, invoked fear for them. And while this is less, it still is significant. 6% of our students said that they were stalked over the past year with at least one of these incidents. And about half of them said that the person stalking them was a UK student or employee. Pending legislation may actually require that we report dating and domestic violence. So we have gone ahead and assessed physical violence in relationships as well as serious psychological abuse. What's important for you to know is these questions were only asked of individuals who said, yes, I was in a relationship in the last year. So that's why the numbers are going to be smaller. But these percentages represent the percent out of the number who were in relationships. So we have 7% of the students saying, I had a physical abuse incident, something happened toward me. And again, about half of them said, my partner is a UK student or an employee. For serious psychological abuse, that always is reported at higher rates than physical, although it's still significant, 17% saying a serious psychologically abusive incident happened to them in the past year, of which, again, about half of them said the partner who did that to me is a UK student or a UK employee. Now, next I'm going to talk about sexual assault. And before I put up that slide, because you'll want to start reading that slide, I want to mention how we defined it. It's a very important thing to do when you try to compare your data with other surveys. We assessed unwanted sexual experiences that you did not want to happen at the time they occurred. Unwanted sexual experiences were defined as intercourse, oral sex, anal sex, or penetration with an object. And it could have been that somebody was attempting to do that to you and you escaped. Once we went through those filters with the students, we then asked whether or not these unwanted sexual experiences had occurred under, again, federal guidelines for sexual assault. Basically, two forms of incapacitation were assessed with the students. We said, were you on alcohol or drugs to the point where you physically could not consent? And that's when it happened. We also asked about, were you incapacitated from drugs or alcohol because you were slipped this in your drink? We asked about, were you physically forced to engage in these unwanted sexual experiences? Were you threatened with force? And were you being forced but were able to escape? So 5 different criteria that if they said it happened under those circumstances, this qualified as being sexual assault. So with that, you need to know that 4.9% of our students, male and female combined, reported a sexual assault during the past year. They were then asked, where did it happen? Because again, you always want to see if you can come up with any ideas with regarding prevention. 27% were in UK housing, and that is specifically dorms and UK-owned apartments. Another 4% says UK affiliated on campus. That basically means somewhere on campus. It could be a building like the library, it could be outside, or it could be a fraternity or sorority that's on campus. Another 6% were UK affiliated off campus. This could be you're on study abroad, you're on a UK-sponsored field trip, or it could also be a fraternity or sorority that people would think would be UK affiliated, but it is off campus. And then the rest, 62%, reported that it happened off campus. Now, I looked at that data a little more closely, and it appears that the majority of those are reported as happening in students' apartments and houses. So it's still, the main picture that you get from this, as President Capilouto said, it seems to be happening where the students live. We also said, who did this to you? And I assure you we didn't ask for any names or identification, but we were attempting to find out, was it a UK student, was it a UK employee, or someone else? And as you can see, the vast majority of sexual assaults are reported as being committed by UK students. 3% by a UK employee, and remember that can be the vast range of employees, and 22% by someone having no connection to UK at all. One thing that people always ask is, well, how does this number, 4.9%, how does that compare with other surveys? We looked for national surveys that appeared to be representative, and we looked for ones that defined sexual assault the same way we did, so that we could actually compare the data. And the data, the 4.9%, seems right in line with 3 different surveys that I found that ranged from 3.4% to 5.7%, and these were just of the female college students, whereas ours currently includes males as well. Pending legislation is also very interested in what happens when a student is sexually assaulted. Do they tell someone at the university? What is the university's response when it occurs? And if they're not telling people, why are they not doing that? So even though we've asked a lot more questions of individuals who said that they were sexually assaulted, I'm reporting today on who do they tell. We find that most students are telling informal sources. 63% are more likely to tell family, peers, maybe clergy. They might go to a medical source somewhere else, but most are going away from the UK campus. Now, some students have done both, told somebody here at UK as well as the other sources. And there is some utilization of UK services. We have about 6% going to the Violence Intervention and Prevention Program, about 2% going who are telling our police on campus, another 3% who've used our health services, and then we have a group that is about 8% that we call UK affiliated. That can be anybody else on campus. They could have told a faculty member, they could have told their resident advisor. So there's some utilization, but we're still wondering, why are they not reporting it? Why are they not telling individuals at UK where we have services and where there is a definite desire to be helpful to them? So we had an item that gave them about 12 options about why, if you did not seek help from UK, why not? And they could, again, answer more than one. The top reasons, the main reasons, seem to be personal reasons. Students say, most often, I wanted to forget about it. I just wanted to put it away. Second most important reason was, it was private. I don't want it to be public. Third is that they said that there was embarrassment, that they were ashamed. When I've talked with Rhonda Henry of the VIP Center, she said these are very much the kinds of things that students tell them seem to be very important for their reasons for not going to more formal reporting. Interestingly enough, 18% said they did not want the person who did it to get into trouble. And what I think is a very important item for UK and the administration is that 26% of the students who were sexually assaulted said, I did not want to deal with formal procedures for reporting a sexual assault. So that we'll need to be thinking about how to work with the students with regard to more reporting. What we did do, and what is encouraging, there were 2 items that would be negative. They could have said, I didn't tell any people at UK because I thought I wouldn't be believed, I'd be blamed, or that they wouldn't understand. And these were very infrequently endorsed, 15% each. So again, it seems that there doesn't seem to be a negative attitude toward reporting toward UK, but rather it seems to be more personal reasons. As I had mentioned earlier, we're hoping to have a very thorough report toward the end of the year, and thank you very much.
Thank you, Dr. Follingstad. I said earlier that this survey wasn't a silver bullet, but it is a bullet that has got to pierce the hearts and minds of everybody on this campus that has responsibility to one another and responsibility for the welfare of what is most precious to us, and that's our students. So we wanted to foster, first, a community at the University of Kentucky that responds to results like this. And the value of all of this is that we heard from the reason we're all here, and that's students. We learn by listening to them, and we best prepare them for lives of meaning and purpose by responding to their questions, to their comments, to their concerns in the classroom and outside of the classroom. Our students have a strong advocate in their Student Government Association president, and I would like to ask Austin Mullen to please come forward and say a few words.
Thank you, President Capilouto. Good morning. The CAT survey asked students, which covered questions with a breadth and depth of issues surrounding safety on and around our campus. These questions range from sexual violence to the general perception of campus safety. 24,382 students completed the survey, and the vast majority, over 90%, feel safe at the University of Kentucky. This can be credited to many things, such as the CATS Path, CATS Cab, Blue Light Towers, Safe Cats, the Live Safe Safety app, among other services provided to students to help us remain safe. With this said, there's still much room for improvement. 4.9% of students surveyed reported unwanted sexual experiences. 2/3 of these students did not report this to the university. UK must continue to educate students on how to prevent, intervene, and report incidents of bullying and sexual violence, and must continue to make students aware of resources available, such as the Counseling Center and Green Dot training through the Violence Intervention and Prevention Center. Dr. Follingstad shared some statistics with us today. Those and others will be used in order to gauge where effort and resources must be placed in order to address issues impacting safety on our campus. Continuity of the CAT survey will allow the university to make comparisons as we move forward. Comparisons will enable us to assess improvement and discover areas in which more attention must be directed. The CAT survey has increased our awareness of successes in areas where improvement must be made regarding campus safety. It is now our duty to use these to build and sustain a safer and more inclusive campus. Thank you.
Thank you, Austin. Before I invite Dr. Follingstad to come forward and VIP Center Director Rhonda Henry, Dr. Robert Mock, our Vice President for Student Affairs, I want to talk a little bit about our path forward. This is a big, important step today. One of the first things you can do before you start an intervention is to raise the awareness, and to raise the awareness with a level of granularity that guides your path forward. So I want to thank Dr. Follingstad and her team again. And this is not a one-time commitment. We're going to do this over the next 5 years, be funded out of my office. There's still questions that we must answer, but each time we conduct a survey, we'll pause, develop interventions. We'll test those interventions as we go forward. We'll conduct our survey again. And each time, it is our hope to get better and better. So the numbers inform policy. They bridge gaps. They help us fashion answers to move forward. Now already, for example, we've shared the data and open responses with key units on our campus, Student Affairs, UK Police Department, among others. So we'll begin to take action. Later this week, we will welcome representatives from public and private universities from across Kentucky, as well as a representative from the Southeastern Conference. We will share with them the steps we took throughout the survey so that they too can learn from us and we can further learn from them so that we can all take effective action to improve safety on all of our campuses. So this is more than a survey to fulfill current and potential reporting requirements down the road. It's much more. This is a project that will help us make informed policy decisions to make this the safest campus possible. So I again, thank all those people. This was much more than a job. This was a deep commitment where you were able to bring precious talent that I would say doesn't exist on too many campuses across the United States. And I want to thank all of those involved. Jay?
If we have any questions from the media now, and also our participants will all be here afterwards. We want to do one-on-ones, but are there any questions, gentlemen? Okay, great. Dr. Capilouto, Dr. Fawn said her colleagues will be here afterward if you have some one-on-ones. Thank you very much.